We're going to be talking about an integrative approach to breast cancer. And with me, I have Dr. Carol Lourie, who is a dedicated practitioner with over 3 decades of clinical experience as a naturopath, acupuncturist, and homeopath. She's helped thousands of women recover their health and restore their life through her holistic protocols involving focused nutrition, targeted supplementation, lifestyle changes, and a centered mindset. So according to Dr. Carol, the key to wellness is to understand that treating the symptoms of a disease is not going to help you recover your health. You need to get to the bottom of what caused your illness to begin your health journey. I definitely agree with that. And I'd like to thank you for joining us.
Well, I'm really honored and excited to be here, and thank you for having me.
Why don't we start out with your background, Dr. Carol? Well, let's talk about how did you start helping people with breast cancer?
Well, I didn't start out by focusing on breast cancer. I started out wanting to go to medical school many years ago. And then I was living in a spiritual community in New York, and my roommate had cancer. And I went with her to Memorial Sloan Kettering when the doctors told her, there's nothing more we can do. You've had a ton of radiation, and basically you can go home and probably die in a few years. And she was in her 20s, and she looked at me and said, no, I don't think so. So she investigated and found out, discovered this doctor in Long Island who was doing detoxifying diets using iridology. And you need to understand that this was in the mid 70s when the word detox was not a household name. And I started working in his home office, and I started seeing people come to him, all different types of people. And I was with all different types of medical conditions. And I was extremely naive in the power and the beauty of natural healing. A young woman came in with acne, and I thought to myself, she has acne. What's the big deal? Why is she here? You go on antibiotics. Then she came back a month later, and her skin was clearer, and she had lost weight, and her whole energy was different. And I saw that with a lot of the people who were coming to see him. So that was my introduction really to, there's another way of working with illness and disease. And then one day I was going through this very large pile of paperwork, and out popped the catalog to the National College of Naturopathic Medicine. And I thought, maybe I should go here instead of regular medical school. And that was the beginning of my journey of becoming a naturopath and an acupuncturist and a homeopath. And I've been on that path ever since. And that was a long time ago. I think the beauty of natural medicine is that it's science-based and it takes the best of both worlds. It's not one or the other. You don't want to pit natural medicine against regular medicine. It's a bad idea to make it us versus them. You want to use the best of both worlds, no matter what your illness or disease is.
So when discussing an integrative approach to cancer, what is exactly meant by that? Or what is your definition of an integrative approach to cancer?
Well, I think that's a good question, your definition. Ideally, it's everyone's definition, which is you want to take the best of both worlds. Integrative or complementary is using what regular medical oncology has to offer, and then adding in the other side of treatment, which is to reduce the side effects, to prepare for chemotherapy, to protect your healthy cells. And then when you've done with active treatment, to recover from radiation and chemotherapy, restore your health gut, reduce the oxidative stress caused by radiation. And then the third phase is to really reduce the risk of recurrence.
Do you know what the rate of recurrence is approximately?
Yeah, it can still happen even 20 years later after you've been initially diagnosed, but the risk is greatest in the first 2 to 5 years. And there can be up to a 15% recurrence rate. And you don't want to be in that statistic. And there's a lot you can do to make sure that is not you.
And I'm sure, there are people who are listening to this and it's easy to put yourself in a situation when you're not in the situation, meaning that, there might be some people thinking, well, if I had breast cancer, I wouldn't want to get chemo or, get radiation. So like you said, an integrative approach, you're thinking about it like people who might go through those procedures and then also just looking to try to address underlying imbalances and preventing a recurrence. But do you have any thoughts on those who just want to completely go natural and don't want to receive any chemotherapy or radiation?
Sure. I think a lot of that decision needs to be based on the parameters of the tumor and what comes back from the pathology report. And sitting down with both your oncologist and an integrative doctor who has experience in this area, and then making that decision from the standpoint of what's going to ensure my longevity for the long term. But there are women and people who, men also get breast cancer, we should say that, but that's not the community that I work with. So I'm going to use the word women because that's who I work with. There are women who adamantly refuse to do traditional, I should say not traditional, medical oncology work. And that is their choice, of course. There are clinics that I know of in Europe which really use non-medical methods to address the tumor and cancer, and I can refer someone there. But my area of expertise is the woman is under the care of an oncologist, and I'm offering supportive supplements and clinical advice regarding reducing side effects through nutrition and homeopathy. And I'm not the primary doctor treating this illness.
Can you talk a little bit about the diet? Is there a specific diet that you recommend for breast cancer, or does it depend on the type of breast cancer someone is dealing with?
There's a lot of varying options out there, and I have women come into my practice. They're keto, they're vegan, they're doing the Budwick protocol, which is cottage cheese and a certain type of oil, which I think is absurd. Vegetarian, they're doing the standard American diet. They are overwhelmed and they don't know what to do. There's a lot of research about the ketogenic diet, and if there is a case of brain cancer, that has been, or epilepsy, that has been proven to be very beneficial for brain disease. And there are people who feel that even with breast cancer, you should be on a ketogenic diet. I have more of a modified Mediterranean approach, which it's the word modified. It's because it's gluten-free, it's very low carbohydrate, and it's almost all sugar-free. And so it sort of verges between ketogenic and modified Mediterranean. And we really need to reduce the amount of sugar available to the cancer cells, because in 1918, there was this German scientist named Otto Warburg, and he won the Nobel Medical Peace Prize for that. His discovery, which was cancer given a choice between glucose and oxygen for what I call the cancer gas tank, it chooses glucose, even though it has to work much harder and go through a more difficult pathway to get there. So no matter, the ketogenic diet is also, it's a very low, you want to reduce the sugar. And that's what happens when you don't eat any carbs. But people have to live and they have families, and it can be very difficult to live in a family unit if you're eating only keto, because you don't want to ideally have to cook one way for yourself and one way for the family. So the modified Mediterranean, I believe, takes the best of both worlds, the ketogenic style and the research which has gone into the modified Mediterranean diet over 25 years with thousands of women has shown that eating this way does result in a reduced risk of breast cancer.
Okay, so from what I understand, if someone absolutely wanted to follow a strict ketogenic diet, there's no problem with that. It's just
No,
that it is restrictive, and as you said, it
well,
might be difficult for other family members. You might have to prepare multiple meals. So the Mediterranean modified Mediterranean diet is not easy to follow, but not as difficult as ketogenic. But it sounds like it's effective, or else you wouldn't be recommending it.
I think it is very easy to follow. First of all, this brings in a really important concept for the way I work and how I want to encourage women to view what they're doing with their life, which is, it is easy because you're choosing to do it. And the way the standard American diet supports or proposes that you eat does not support health. It's literally, there's a lot of research which shows that the standard American diet quadruples the cancer rate. So that's a really clear indication that how you were potentially eating and how you should or want to or choose to eat now that you have a cancer diagnosis, there needs to be change. And this modified Mediterranean is filled with luscious food. There's lots of healthy fats in it. It's easy to prepare. And it's really wonderful for not just you, but the entire family. You can go out to eat and order appropriate food. You can go to somebody's house and hopefully enjoy what they're having. I think it really encourages health all around. So I think it is easy, but it is definitely not cereal with milk in a box for breakfast, which nobody should be eating no matter what.
Yes, definitely agree. That's how I ate growing up.
We
had
all
had my
did.
Fruit Loops every
We all
morning
ate
for
that
breakfast.
way growing up,
Yes.
right?
Okay, well, thanks for sharing that with regards to the diet. How about stress and emotional trauma? Can you discuss the connection between those and breast cancer?
Well, it's almost impossible to be an older person and not have had something upsetting or traumatic happen in your life outside of being diagnosed with cancer. And many times when I first start working with a woman, I'll say, have you had any trauma or upsetting experiences in your life? And she'll say, well, yeah, there was this incident that happened 25 or 30 years ago, but it couldn't be that. But the reality of it is that it absolutely can be because we have a protective mechanism in our body. And when something upsetting or traumatic happens, we take a breath in, and the energy of that event is gone, it puts into our cells, and it sort of hangs out there. And we process at that moment what we are able to handle emotionally, and the rest of it is stored in our psyche and our cells. And then over periods of years with added stress and busyness and elevated cortisol and the chaos of life, all of a sudden the overload of all of that emotional work and that restraining can pop up. So you can have a lot of unexplained depression and anxiety and the creation of illness. And it doesn't have to be just breast cancer. It could be an autoimmune problem or insomnia or gut problems or some other form of cancer. So I think incorporating and acknowledging the trauma of the past into the healing that you choose to do and you want to do in the present is very important and helpful.
Do you recommend any techniques, whether it's mind body medicine techniques or working with a counselor? Does it depend on the person?
I'm a big proponent of therapy. I think therapy is really wonderful. And there are different forms of therapy. And I think it's important to interview the therapist. Ideally, I think women should be working with women therapists, but you need to interview the person you're choosing to see to make sure you feel comfortable and safe with them. And the type of therapy they do is a good match for what you're looking for. And you go into therapy not just one time. Ideally, you go in, you do a bit of work, and then you settle, and then you go back because other stuff comes up. So being in therapy off and on throughout your life is really a healthy way of looking at your mental health.
How about the impact of environmental toxins, such as xenoestrogens? How have those impacted breast cancer rates?
Well, I'll give an example of a 35-year-old woman who came to see me, and she walked into the office. I have a scent-free office, and she had on enough perfume that you could think that you were on the ground floor of Macy's. And for those of you who can relate to that statement, it's the makeup area, and it smells unbelievable. And she walked in, and I said to her, "So tell me about scents." And she said, "Oh, I love scent. I have those plugins in the wall. I have the sticks in the oil." And this was the cincher for me. I spray my sofa with Febreze. So there are, as you mentioned, xenoestrogens, and xenoestrogens are estrogen blockers. And what that means is there are certain chemicals which look like estrogen. So estrogen in your body needs to be metabolized to be excreted in the healthy form. And in order to do that, it needs to go into sort of like the parking lot or the parking garage and park, and then it's bound to a receptor and then it's excreted. But these xenoestrogens or estrogen looking like chemicals take up the parking spot in the garage. So when the healthy estrogen goes to park and to be excreted, there's no space for it, and it turns into an unhealthy version of itself, and that is what's known as estrogen dominance. And that can create infertility, polycystic ovarian syndrome, lots of menstrual irregularities, endometriosis, and breast, vaginal, ovarian cancers, all of those. So detoxifying your home is a very important aspect of recovering your health. And I said to this young woman who came to see me with the diagnosis of unexplained infertility, could you go home and put every single item that you use in your cleaning house, to on the counter and take a picture? There were 29 items on that countertop. So I said to her, you don't have unexplained infertility. You have, well, now we have an explanation for why you couldn't get pregnant. There's too many chemicals. We had to throw out her sofa because she couldn't detoxify her sofa. And she spent a week cleaning everything in eco laundry detergent and throwing all the toxic shampoo and the soaps out and everything. And within 3 months, she was pregnant. And I should explain that when you wash your clothes and then maybe use a dryer sheet, when you get in the shower or when you sleep, your pores are open and you wrap your body in a towel, and the chemicals from the laundry detergent, the over-the-counter laundry detergent, and the dryer sheets are then absorbed into your skin. So your skin is a porous organ, and all those chemicals that you use in your laundry detergent, your shampoo, your body wash, all of those have these chemicals that block healthy estrogen from being excreted. So detoxifying your home is the first step of reclaiming your health.
So you recommend natural cleaners, natural cosmetics, furniture could also play a role. The
Well, if it's
sofa.
been sprayed with Febreze, you need to
Yeah.
you can't get that chemical stuff out of the material on the chair or the sofa. So you need to really consider just buying new furniture, unfortunately. Even if you steam clean them, the chemicals are still there.
I assume you recommend like things also to support detoxification in addition to trying to minimize exposure.
Yes, but now we're getting into supplements. I mean, absolutely. I'm a big proponent of supplements. I think supplements are really important. And women say to me, well, can I get everything from the food I'm eating? And even if you're eating 100% organic, if you have breast cancer, you need to support the pathways that block the cancer and increase the pathways that promote health at a level that eating regular diet, even organic and lots of phytonutrients from vegetables and everything, you need more than what you can get through your food.
Do you recommend, in addition to supplements, do you recommend other methods of detoxification such as infrared sauna? I
Oh,
know
yeah.
Gerson uses coffee enemas. I don't know if you recommend coffee enemas, but
I'm not a big coffee enema person. I'd rather do Epsom salt enemas. And what happens when you use Epsom salts is you take 2 tablespoons, you boil the water, you add the Epsom salt, you dissolve it in a jar or glass Pyrex, and then you add that to your enema bag. And so it's a little bit of water with Epsom salts with the rest of the bag. And what that Epsom salts does, and this is from the doctor that I studied with the that I became interested in natural medicine, is it pulls toxins from not just your gut, but from your lymph. It's not about being constipated. You don't want to be using an enema to help you eliminate your daily evacuation. You want to use an enema very targeted, not all the time. So, and you need to prepare when you do that. You want to change your diet for a day before, eat very lightly, then do the enema, and then the day after also eat very lightly before you go back to your regular diet.
okay. So you're not recommending daily enemas then, it
Oh,
sounds like.
absolutely not. No, absolutely not. If you have constipation to the point where you're not eliminating daily, then we need to do some work on what's happening with why you're not able to evacuate on a daily basis. And there are a lot of Americans in the US who are constipated. People come in and say all the time, well, I go to the bathroom maybe every other day. I'm not sure. Maybe every couple days. So as we get your health better, we need to have one evacuation in the morning and then maybe another little smaller ones 1 or 2 times a day. That's a healthy intestinal elimination of toxins.
And getting back to the supplements, so there are a number of different supplements that could help with detoxification. There's milk thistle, there's N-acetylcysteine, there's alpha lipoic acid,
You
and
mentioned
then
all the
there's
ones that I was thinking of. Yes.
yeah. So it sounds like you use those. Do you also use supplements like DIM to help with estrogen metabolism or calcium D-glucarate?
I use calcium deglucarate, but I don't use DIM because, well, it depends. If a woman is on tamoxifen or aromatase inhibitor, I think DIM is contraindicated or you don't need it. So we have to stack the supplements because they're on a lot. And so we have to be very specific about what we take. And you can, and sometimes people say to me, well, can I just take DIM instead of an aromatase inhibitor or tamoxifen? And you can't really take enough DIM to block the estrogen. And really, if you have estrogen positive, hormonal positive breast cancer, you want to block the uptake of that hormone. The problem with tamoxifen is that it isn't without its side effects, as is aromatase inhibitors, and they're a little bit different. Tamoxifen is anti-estrogenic in how it blocks the hormone from your breast, but is pro-estrogenic with what happens with your uterus. So there is a 15% risk of getting uterine cancer. So before a woman ideally is prescribed tamoxifen, I encourage her to speak with her oncologist to get what is known as a CYP2D6 enzyme test. And that enzyme is the enzyme that breaks down the tamoxifen. And if you have a deficiency in that enzyme, then you're going to get an uptake and an increase in the tamoxifen and dexafen byproduct. And that can contribute to lots of oxidative stress and an increased risk of uterine cancer. So you need to be prepared to speak to your oncologist about this. And also there are certain supplements and methods that we use to reduce the toxicity of tamoxifen and the side effects of both tamoxifen and aromatase inhibitors.
I wasn't going to get into the genetics, but since you brought it up, would you recommend other genetic testing, like for the COMT enzyme or the COMT enzyme or MTHFR that play a role in
Well,
estrogen
those are
metabolism?
fine to know about, but I don't think that's, I mean, yes, if you're MTHFR deficient, we want to make sure that you're getting the right form of folate, right? And if you're COMT deficient, we know that your pathways to metabolize are a little deficient. So we have to absolutely make sure you're taking enough calcium D-glucarate and berberine and maybe doing castor oil pack on your liver once or twice a week. So absolutely, but that's not the major driving factors of what has contributed to your breast cancer. And there's no one thing, I should say that. There's no one thing that makes or creates breast cancer. It takes a while for this tumor to develop. And so when you're initially diagnosed, it's most of the time, it's not a surgical emergency. So you can take a week or two to get a second opinion. If you have children at home that need to be taken care of, to develop a care tree. So the kids are being dropped off at school and being taken to their extracurricular activities. You need to involve friends and family to take care of the children, to bring food, because women multitask so often that when a woman of the household is not feeling well, a lot of things are too much for her spouse to take on. So it does take a village, ideally, to get through breast cancer.
How about testing? Do you recommend testing the hormones either through the blood or doing like dried urine testing?
If a woman wants to check her hormones with what we would know as the Dutch hormonal panel before she either starts treatment or after treatment is over for a while, before she goes on tamoxifen and aromatase inhibitor, I think that's a valid thing, especially if it's a young woman. There are women getting breast cancer earlier, like at the age of 32. I have several young women. So if you get breast cancer at that age and there isn't a family history of either breast cancer or colon cancer, then we absolutely want to understand what's happening with your estrogen and hormone metabolism. So the Dutch hormonal panel tells us how your hormones are being broken down and at what level is there a problem, so we can then target that in addition to whatever medical treatment you're doing. But for the older women who are on tamoxifen or aromatase inhibitor, that test is not valid. It's not going to show us really give us any valid information. There are other tests we could do.
Okay, so if someone's taking a tamoxifen, they wouldn't want to do the Dutch test, at least for the
No,
purpose of looking at the estrogen metabolites.
no, it's not because it's being disrupted by the drug, right? And aromatase inhibitor. Aromatase inhibitors block the aromatase enzyme, and the aromatase enzyme is the enzyme that's responsible for taking the androgen, and then it goes in with the aromatase inhibitor. It's then broken down into either estrogen or progesterone. So that is blocking the conversion from the androgen. So it's not a valid test if you're on either one of those types of drugs.
Is there anything that people shouldn't do with regards to supplements they shouldn't take or foods they shouldn't eat? I know there's some controversy with like phytoestrogens, like soy, flax, or anything else that you would say. Well, I guess if you don't mind, can you talk about the phytoestrogens? What are your thoughts about phytoestrogens and
Right.
cancer?
Well, in answer to the answer of the question to soy or not to soy, because I wrote an article about that. The where we need to start is looking at the Japanese culture before it became westernized. And the Japanese culture before it became westernized, i.e., fast food and American style food, processed food in their culture, when it was pure Japanese culture, they had almost no breast cancer. So that right there is research and statistics for the answer of to soy or not to soy. Their soy was non-GMO. So unfortunately, when people eat soy, it's in soy snacks and it's like, but if you're getting organic, non-GMO soy and it's hasn't been fried in a toxic saturated fat oil and turned into a soy snack, soy and gluten-free tamari are fine. Now, are we eating 8 ounces of tofu 7 days a week? That's a problem. I mean, how could somebody really do that? But if you're eating 4 ounces of steamed tofu, like I made a kale and tofu dish last night for dinner, and I had, like 2/3 of a block of organic tofu in it, and I had some last night. I'm gonna have some for lunch today. There's nothing the matter with that. That is not going to increase your estrogen in your body. Either is soy milk, but you have to make sure. I'm not a big proponent of soy milk because I don't, even though people do their best to make sure the soybeans are non-GMO, it's very difficult to control all of that. And if you're drinking like 8 ounces of it every day, that's a lot. And luckily, there's different types of nut milks that you can drink, so you don't have to really be drinking soy milk if you want a non-water product to drink. So I don't think there's a problem with soy. The caveat is it needs to be organic and non-GMO, and you're not eating it every day of the week.
And I assume with flax, like flax is okay too, like if you're having
Flax has
organic flax.
lignans in it. I mean, the dark you when there's two types of flax. There's a lighter seed and a darker seed. You want to buy the darker seed, number one. You want to make sure it's organic. You want to smell it before you bring it home if it's in one of those bulk things, because flax as an oil is very sensitive to heat. So if it smells fine, you want to bring it home, put it in a glass jar, and keep it in the freezer or the refrigerator. And then what I recommend is you either use a mortar and pestle before you put it in your smoothie. You either use a mortar and pestle and break up some of those seeds, or you get yourself a $10 coffee grinder that you just use for the flax, and you just pulse it like 2 or 3 times. You don't need to make a powder of it. You just want to break up some of those seeds. And if you don't want to do any of that, it's fine. People put it whole into their smoothie and drink it every day. But you get more of the lignans available. So absolutely, there's no phytoestrogen. I mean, what are we doing eating a pound? We're eating a tablespoon or two, right, in our smoothie. So there's absolutely no, I mean, sometimes this verbiage gets out there and people go, oh, I can't eat flax. Flax is a really healthy oil, right? It's a big, powerful antioxidant. It has really positive anti-inflammatory lignans in it. So I think flax is a wonderful thing to eat every day.
Yeah, what I do is I buy organic whole flax seeds and do what you mentioned. I have a coffee grinder.
Right.
And I put them in again, a tablespoon, not a pound, tablespoon of flax seeds, a whole flax seeds, grind them and add them to my smoothie. So I do
Yeah, it's a
exactly
really
what you
easy
mentioned.
way of getting a lot of positive lignans. And I should just say that Dr. Eric's area of expertise is the thyroid, and often the stress of going through cancer can bring out a latent thyroid problem. So there is fatigue that's associated post chemotherapy, radiation, surgery, and then with the addition of hormone blocking drugs, there is a lot of fatigue that often shows up. But one of the things we need to look at, and Dr. Eric is this area of expertise, is have you like developed a thyroid problem? So if you're having unexplained fatigue, when you go to the doctor, too often they'll say, and this is a very upsetting phrase for me, well, let's just put you on some antidepressants for a while and see if that helps. I'm not opposed to antidepressants, but I don't think it should be first line therapy. So if you're having unexplained fatigue, first of all, it's not unexplained. You've been through an arduous 18 months or longer of treatment. It can bring up a thyroid problem. And there's a lot of emotional trauma that women tend to put on the back burner. And while they're getting through treatment, then all of a sudden it's not all of a sudden, when you're done treatment, it just comes rushing up and you're emotionally overwhelmed. So before you go on antidepressants, which might be your choice, but let's see if it is the thyroid problem. Let's see if you need to detoxify, and let's see if working with an integrative person for a month or 6 weeks, if you have that time frame. If you're severely depressed and you can't get out of bed, then that's more like an urgent care moment. But if it's just low level depression, and I don't mean to say it's just, if it's low level depression, let's do a differential diagnosis and see if is it your thyroid? Do you need to detox? Do you need to do some therapy to understand and appreciate all the trauma that you've been through? Because it is very disruptive of your life. And it does create this ripple effect, not just for you, but for your spouse and your whole family and your household. The other component of this is when you're done active treatment, your workplace, if you work outside of the home, and your family think, oh, she's done now, let's get her back to, she's going to be back to her normal self. And that's not necessarily the case. You may not be feeling well, you may have fatigue, you may have emotional trauma, you may have developed anxiety. All of these are real and appropriate. So you're not back to yourself. There's been body changes. If you've had surgery, you've had 1 or 2 breasts removed, that's a big deal, even with reconstruction. It's not such an easy moment. And so fatigue and depression are very common and very normal. And that's part of the emotional recovery work that we need to do and help you with when you've been through cancer of any kind, especially breast cancer.
Yeah, thank you. Thank you for sharing that. So it sounds like it's common for women that go through this to have fatigue and
Very.
depression, which again, not a surprise. So you typically will recommend for them to do a full thyroid panel?
Oh, absolutely. I love testing. I'm a big testing person. And the more testing provides us information about what's going on in your body metabolically. Cancer is a metabolic disease. The more information we have, the better it is to, easier it is to address that with nutrition and supplements and lifestyle. And just doing a TSH is inept. We need to
Yeah.
know if you are having inflammatory antibodies that are showing up in your thyroid, right? Are you developing hypothyroidism, Hashimoto's? And it's not often, very rarely does the doctor do a complete thyroid panel the first time. But if the woman knows to say to the doctor, you know, I want more than a TSH, I want this and this and this, then they can hopefully have a doctor that works with them and get those additional tests done.
Yeah, I definitely agree. Unfortunately, still a lot of medical doctors will just look at the TSH. And I mean, endocrinologists might go a step further and they might do a lot of times they'll do a T4. Maybe they'll look at free T4 and free T3. The antibodies, it depends. And, I deal with a lot of hyperthyroid patients, and usually
Oh,
they'll test for antibodies. But with Hashimoto's, the treatment is pretty much the same. If someone has antibodies or they don't have antibodies, usually they're going to be given thyroid hormone replacement. So
mhm.
some doctors don't test the antibodies, unfortunately. But yeah, either way, I agree. Regardless of the symptoms, more hyper, more hypo, do a full thyroid panel with antibodies. And yeah, the reason I wanted to interview you, I chatted a little bit before we started the interview, is because I've had some patients with breast cancer. But interestingly, I've had, I think, more patients with Graves' disease who had breast cancer than
Hmm.
patients with Hashimoto's. Now, it could also be because I see more patients with hyperthyroidism and Graves' disease than I also see people with Hashimoto's too, but more, the majority are people with hyperthyroidism just because that's what I dealt with. But so really, I guess it doesn't make a difference. Maybe there is a higher prevalence in Hashimoto's. I'm not sure. But either way, whether you have hyperthyroidism Graves, hypothyroidism Hashimoto's, there is that risk. And I don't even know if there's an association. I think the research is a little bit unclear if there's like that connection. I know there's, you know,
Between thyroid disease and breast cancer?
correct.
I don't know of any, but I'm not saying there is or isn't. I haven't researched that component of that illness and breast cancer. In my clinical practice, it's not uncommon for a woman to develop a thyroid disorder after treatment, after the stress, physiologically and emotional stress of treatment. But I don't think a thyroid disease like hypothyroid disease contributes to breast cancer.
Yeah, from what I've seen, I don't think so either. Same thing. It's a little bit iffy with hyperthyroidism. There actually are some studies, but it
Okay.
seems to be unclear as far as if there's a connection. So we'll see what future research shows. So what are some action steps women can take if someone was recently diagnosed with breast cancer? What are some action steps that she could take, for those who are looking to take an integrative approach?
Well, understand that you're the oncologist you're seeing at the health center or the medical center, they have a certain area of expertise, and that's this integrative care is not their skill set. They follow a protocol that's been researched with you have this type of cancer, you get a mammogram, it's discovered, you get an MRI and an ultrasound, and then you have a biopsy, and then that generates a pathology report. And from there, it's then decided, do you need neoadjuvant chemotherapy? Neoadjuvant chemotherapy means the tumor is a certain size, it's estrogen, it's hormonal positive, and if they give you chemotherapy beforehand, the tumor will shrink, and then hopefully you'll be able to have a lumpectomy and not necessarily a mastectomy. So there's a lot of decisions to make in that initial chapter. And bringing in an integrative practitioner right away to help you, first of all, make sure that you're getting the right tests. For example, if you have something that's called DCIS, the next moment the oncologist should order an Oncotype breast cancer recurrence index test. And what that does is it gives you a number which will tell you your risk score. If you do chemotherapy and or radiation, doing that will reduce your risk of recurrence by XYZ percentage. That's really important information. So you want to know that. Unfortunately, sometimes women have DCIS and they come to see me and I go, well, do you have an Oncotype? And they go, no, the doctor didn't order it. So if you know that, you can say to the doctor, my understanding is this is a really valid test that should happen with my type of breast cancer. I'm wondering if you can order it. So you want to take the best of both worlds. It should be ordered. There's other more advanced diagnostic genomic SNPs tests, which according to the methods that the oncologists use, may not be used at that first stage level. For example, there's the Caris molecular intelligence test, there's the neogenomics test, and those go further into the genomic SNPs that created your breast cancer. And also they'll give you chemosensitivity. Is your tumor, what types of chemo does it respond to? And thirdly, they'll then say, well, these are the clinical trials you might be eligible for. But the way the medical oncology works is that test is not usually run as part of first-line treatment. If you have the funds, you can talk to the doctor about it, and you'll have to pay out of pocket because first-line treatment will not cover those tests. If you fail chemotherapy, then your insurance can be billed, and it will be covered because it should be covered because it's part of second-line treatment. So there's a lot of information that you need to know about that is not normally discussed with your medical oncologist.
Is there anything that I didn't ask that I should have asked? Anything else that you'd like to discuss?
Well, I want to talk about reducing risk of recurrence because so often women are they if you finish active treatment, you ring the bell, and then all of a sudden the oncologist disappears and you're told to take a pill, and that's sort of it. And that really isn't it, because cancer is a metabolic disease. And what that means is that that gives you a lot of empowerment to really reduce the risk of recurrence, because you have the ability to make your body less hospitable to cancer recurrence. So it doesn't have to be random. And that's how I developed my Empowered Against Recurrence program, which is an online live group coaching program with me. Plus, you get the other part of my program, which is science-based online educational aspect, which you have 24/7 access to. So I'm bringing this information to the world beyond the ability of who I can see in my clinical practice.
And where can they find out more about this program? I assume your website.
I have a website for this. It's called empoweredagainstrecurrence.com, or you can just go to my practice website, which is my name, carollourie.com, and use the contact me page at the top. Send me an email and I'll send you any information that I think is appropriate. I answer all my emails personally.
Thank you so much, Dr. Carol. I appreciate you sharing with everybody your experience and your thoughts on an integrative approach to breast cancer. And again, make sure you visit Dr. Carol's website. Anything else as far as resources, or is really everything on the website that they would need?
I have a lot of free downloads on my website, carollourie.com.
Well, wonderful. Well, thanks again. I do appreciate this. And yeah, I learned some things too. So
Oh,
thank you so
good. My
much.
pleasure. My honor and pleasure. Thank you for having me.